Women's healthcare is a high-risk specialty. Here's what happens when a woman goes to the hospital and she's pregnant. In the first half of the pregnancy, she goes to the emergency room where she sees the emergency room physician. In the second half of the pregnancy, that same patient is considered too high risk to see the ER doctor, so they send her up to labor and delivery, where now instead of seeing a doctor, she sees a nurse, and the nurse calls the doctor on the telephone to discuss the problems. And oftentimes the patients never see a physician.
Say a patient comes in hemorrhaging, there was no physician available in the hospital. The nurses managed everything until the physician arrived from home, which could be 15 minutes or longer.
That was one of our challenges. How do we fix that? And by fixing that, I think that it led us along the path of creating a program that really does work and sustainable for hospitals, addresses some of the key issues that patients experience, and again, raises the bar for women's health care improvement.
I believe that when a woman shows up at a hospital in labor, a doctor should be waiting for her. I believe there should be a physician in the hospital all during a woman's labor. By definition, labor is an unstable condition. So to allow women to labor without having a physician nearby to intervene in the event is, in my opinion, a mistake. The same is true for a labor and delivery unit. It's an emergency room, and there should be a physician waiting for a patient when the patient shows up. OB Hospitalist Group has been doing this for a long time, has 50 programs up and running, and understands the industry, the model, the personnel, and the pitfalls.
A lot of hospitals try to do their own program, and I think it's difficult because the infrastructure you need to recreate, simply the billing and the credentialing and the staff to support, not to mention looking at quality initiatives and physician recruitment, all those things that take a lot of time and effort, and essentially you'd have to find somebody or hire somebody within your organization to try to do that. That's going to be a new process, and they're going to go through growing pains, where with OB Hospitalist Group, it's a proven process. There's more than 50 programs now that run beautifully, and so that machine can move in and everything works seamlessly in that regard.
We don't just practice in labor and delivery. We're there to alleviate the burden of the community physicians in the emergency room for patients who don't have a doctor and who present. And we bring a whole wide range of capabilities in terms of surgical expertise that is going to be hard to find in just a homegrown program.
As OBGYNs, you're constantly juggling. You're running back and forth from the hospital to the office to home to trying to do things with the kids and the wife, and it's stressful. You have emergencies that occur and you need to be there quickly, and oftentimes you can't be there as quickly as you would like to be.
I believe we offer a life-changing service to the private community physicians in the sense that not only are we readily available to prevent a delay in care from a medical perspective, but we also give them the security and peace of mind that there's a physician directly ready to intervene at any moment.
My role in the hospital is I'm the lifeguard. I'm the one who's always there. When something goes terribly wrong, I'm the one who shows up in 30 seconds. That's the way I'm perceived, that's the way I want to be perceived. And it works very well in the model, because this way the physicians can be home, they can be at the birthday party, they can be at the Little League game, and I'm there. I'm always there.
Patients no longer need to sit and wait in triage for an extended period of time before being evaluated. Patients are offered the opportunity to see a physician every time they come to the hospital.
I think OBHG is outstanding because of the dedication we have to improving women's health care. We bring a passion of service to the whole organization of the hospital. We're there to serve your community physicians, your nursing staff, your administrators, but most importantly, your patients.